is Cypress, and he's gonna be my patient for the final physical examination. How are you doing, Cypress?
Good.
Good. Do you have any pain?
No.
Okay, so we're gonna get started with this physical assessment right away. So following this paper, you wanna look at his scalp, make sure it's clean, his hair, even distribution, his eyebrows with the even distribution as well, and the color. And then we move on to the eyes. As far as the eyes goes, we can do the Schnell's test, which you use this and you stand 9 feet away. The patient will cover one eye and then the other eye and both eyes, and if they can read line 8, they have a 20/20 vision. And then we can also do the near vision test, where they hold this at 16 inches away and they try to read it without glasses. If they can read down to the bottom, they have good vision as well. And then the next thing you want to do is you want to check their eyes, their sclera, their eyes of motion. So you want to do that with a pen light. I don't have the scope for it. So if you don't mind taking off your glasses, so you just want to take a look both sides and then the other side, make sure you can see jaundice or glaucoma in older people. So you want to do that, and then if they can follow your hand, and then back this way and up, and then down. Make sure that they don't have any lazy eye. And then moving on to the hearing test, you just want to look at to the canal, both sides, make sure they don't have a perforated eardrum. And then you use the otoscope for that one. And then you can also use a turning fork, which I don't have. And we did this in the lab. So this is something that you hit on a hard surface, and you hold on top of their head and then to the side, and you do that with both ears. And then they can hear the vibration or the noise. And then we move on to the nares. And if you don't mind putting your head back a little bit, you just kind of look into their nose, make sure that they're set them straight, clean. And then moving on to their lips. So you get their lips and then their teeth, smile, and then you open their mouth, stick out your tongue, say ah. Okay. And then you want to look way back using the tongue depress blade. So they open up their mouth, open your mouth, and then you use the tongue blade, and then you look way back there, say ah again. And you just want to look way to the back of their throat. And the next thing we'll do is the lymph nodes. So you just want to feel behind their ear, down their neck, and looking for their lymph node. And then they also have some of the axillary as well. And then the other thing is this cervical spine. So if you don't mind standing up, stand up, and then this one they turn this way. Go ahead and bend a little bit forward. And then this one, you just want to make sure that their spine is in the straight line. And if they stand up straight, that they have even shoulders and their back is straight. And then JVD, this one you do is sitting at a 45-degree angle. Kind of lean back just a little, tilt your head, look that way. And you just want to see if they have any JVD here, and then look this way again. And to see, but they're more at a 45-degree angle. And then their thyroid. This one, I didn't bring a cup of water, but they sip water, and then they swallow. So you want to take a look at their throat right here. Go ahead and swallow. Okay, so they swallow. And then we're moving on to the thorax and lungs. So you just want to sit up straight, take some deep breaths, and then the even distribution of both sides of their chest here. And then this one here, you take a listen with your stethoscope. You do the front, deep breath. And then you also do the back. And then you want to go as high as the clavicle bone, and then down here, especially on the back. So you want to go as low as you possibly can for the lungs. They can say boy or boy, and then we listen as a vibration. If you hear the E sound, it's consolidation. So if you just say boy or boy, say boy or boy.
Boy oh boy.
And then you feel the vibration on their backside. And then take another deep breath. And then you just wanna see their chest expansions. So and then we're moving on to the peripheral vascular and the heart. So this one, you wanna listen to their chest again, all in this area here. So the point of maximum intensity PMI is gonna be on their left, the fifth intercostal space, and then you wanna take a listen to that. And then also with the peripheral vascular, you wanna feel their pulses here, and then their feet, and then you can also feel their pulses here too. And then when you listen to their heart, you just wanna listen for their, if it's regular, or you hear a second heartbeat. And then the other one is the skin color and even distribution, the capillary refill where you press on your fingernail, make sure it goes back to the normal color, and any edema anywhere in your legs for older people with heart failure. And then moving on to the GI, go ahead and lay down. So this one, the GI, so I'm gonna look at your shirt here. So you just wanna take a look at his chest, take a deep breath, and then still looking down. And then here you listen to the breath sounds again, not the breath sounds, the vowel sounds, and make sure that they have the movement of their abdomen here, both in 4 quadrants. So you do that, and then moving on, you do the aorta here, the dominant aorta, you listen to that, and then you palpate the abdomen, and then make sure it's smooth, and then you palpate on the liver on the right side, so you want to go up, and then see that, and then you go to the right side is going to be the liver, and the left side is going to be the spleen in the same way like that. Make sure you don't go. Percussion, you just want to kind of do the percussion on them, and then on their back side, go ahead and sit up again. And then the back's different. Their back side, here you want to feel for their kidneys, and you just kind of feel around. Maybe scoot back a little, make sure you can see. And then from the beginning of the assessment, when you walk in, you can kind of assess for their LOC, how they're doing, if they know what's going on, how their mood is, and then you do the grips and pushes. So hold my hand, or scoot my hand, like that, and then you can go up, and then you can press down, and same thing with their feet, the pushes and pulls with them. And then your deep tendon reflexes, I don't have a tool, but you hit it here, and then the elbow, you go up, and then you hit it here on both sides, and the arm should be able to move itself. And then we'll do the Romberg test. Go ahead and stand up. And then you ask the person to close their eyes. Close your eyes and just stand still. And if they're swaying, that's an abnormal sign. So go ahead and sit down. And then their gait as they walk around, you want to check that they have a steady gait. And then upper range of motion, so if you just ask them to move around and move their lower extremity down. And then you just check their spine one more time. And stand up and then turn. Then you just want to make sure that their shoulders are even, their backbone is here, and they have even gait. And so that concludes our physical examination.